Director of the National AIDS Prevention Program, Dr. Perry Gomez, says though the number of HIV/AIDS-related deaths is decreasing, he'd like to see more in a reduction in the new infection rate. Gomez was speaking to reporters today at the close of the regional HIV conference on Paradise Island when he said prevention is still key to changing the country's status as the country with the highest rate of HIV and AIDS infection in the region.
We have decreased the numbers of deaths. But the numbers are still staying steady, and because the numbers of new infections are not decreasing as fast as it should. And so in order to do that, we have to get out there, do the testing, people know their status, keep preaching the message of prevention, being in faithful relationships, using condoms, if you are infected, get on therapy, and so on. But that's the prevention, the upscaling of prevention is the most important aspect of the program.
Now, according to the World Health Organization, at the end of 2009, there were 6,600 Bahamians living with HIV and AIDS. In fact, HIV and AIDS is the leading cause of death among Bahamians ages 24 to 44. Dr. Gomez says though the classification of the vulnerable groups may have changed, reaching them remains a challenge.
We have to do, like I say, much more in prevention, and prevention with vulnerable groups, the most vulnerable groups. The MSMs, commercial sex workers, drug addicts for the Bahamas as well. Cocaine. Remember, our epidemic started in cocaine. Cocaine addicts were the epicenter of the epidemic in the Bahamas. And we don't see as many of them now, but they are still, cocaine is very readily available on our streets. I was told by people I know.